It's 12 minutes past 7 now, and this morning there are warnings that Scots have received less key cancer treatment than other countries, including England. The findings come in two major international studies co-funded by Cancer Research UK and published in The Lancet medical journal. It says Scottish cancer patients faced longer waits to start chemotherapy. That worked out at 2 weeks longer than in England and nearly double the wait of those in Norway. Well, Professor David Cameron is an oncologist based in Edinburgh and the Deputy Chair of the International Cancer Benchmarking Partnership, and they compiled this data. Good morning to you.
Good morning, Gary.
So we're talking here about data gathered between 2012 and 2017. It's from Australia, Canada, Norway and the UK. Given that it is historic data, how useful is it?
So firstly, I think it's very important to realise that these data were gathered from all these parts of the world who have publicly funded healthcare systems. And so we need to wait a few years to be able to pull in the richness of the data that they've analysed. Of course, a couple of years after the end of the data timelines used in this paper, COVID hit us. So it's not really possible yet to have really live data. And many of these jurisdictions can't give you that immediacy of the data. So you have to go back a few years, not that many, to get the richness we've got. But do we really think things have substantially improved since then, particularly since COVID hit us? I don't think there's any evidence that that is the case at the moment.
Well,
so to us, these are important data.
Do you think things may have even got worse? Because we know, of course, the health service is taking some time to recover from COVID.
Well, I think some of the timelines may well have got worse in all these places, yes.
So tell us what this tells us about the Scottish cancer experience.
So the important thing to note is that this is chemotherapy and radiotherapy. And these days, to give people the best chance of cure for many cancers, they need a multitude of treatments. And our waiting time guarantees only count the time to the first one, which may be surgery or chemo, but many patients have all three: surgery, chemotherapy, and radiotherapy. And our concern is that the timelines to get these treatments may, for some patients, absolutely not for all, but for some patients, that might impact on how effective the treatment is.
It also found that patients were treated less often with chemotherapy and radiotherapy, not just that they had to wait, but it seemed that they weren't getting as much as they would do in other countries.
That's true, and it's particularly true for the very elderly patients. I think that's where one of the biggest differences is. And that is something I think we need to look at. Why is it in our healthcare system that it's taking longer to get these treatments and not as many patients are getting them? Where is that bottleneck happening?
Just to go back to the point we were making a moment ago about whether things may or may not have improved, and it is speculative at this stage, the Scottish Government make the point that this data covers the time period between 2012 and 2017, and they say there has been continued improvement to services since. I wonder what you make of that.
Well, one of the treatment time guarantees, which is the time to first treatment, has, as everybody I think knows, actually got worse during COVID. It has just started to improve, but none of the health boards met the guarantee. So I think we are all concerned that the impact of COVID and of all the activity to treat cancer patients doesn't mean this has got better. And Scotland has not routinely measured time to all three of the treatments. It's only ever measured time to the first one. So that needs to be looked at, I think.
Do we have an understanding here? Obviously, we have this raw data. Do we have an understanding of what is happening in some of these other countries? Why things might be different, may even be better?
No, one of the, I guess, challenges of this kind of exercise where you're collating data from many different jurisdictions is that although these are all publicly funded healthcare systems, they do operate in different ways. And that detail as to what is different is more difficult to get at. And in particular, how does it look across the different social groups, demographics, deprivation categories, etc.? That's something which ICBP wants to go on to understand better, because we don't believe that everybody's perfect in every area. But we don't, at the moment, really understand where these differences have come from. And I think that's to my mind, that's why it's important to share your data like this, because you can look and say, oh, I don't look as good as somebody else. What are we doing differently? And those are the exercises I would welcome to be done now to understand why we look different.
And if you're a cancer patient listening to this morning, if you've maybe had a recent diagnosis or you're currently undergoing treatment, What, if anything, should you take from this?
So I think the first thing for most cancer patients is that there isn't an immediate tight correlation between these extra delays, and they're not always huge, and outcomes. So that don't immediately assume because you think it's taking longer for you than maybe a friend or a relative in Australia that you're necessarily going to do worse. That isn't the case. But absolutely, you should discuss that with your oncologist. Does this delay matter? Because in some situations it matters more than others, and in many it probably doesn't matter at all.
Well, look, thank you very much for speaking to us. Professor David Cameron, there, oncologist based in Edinburgh, Deputy Chair of the International Cancer Benchmarking Partnership, who compiled this data. Let's have a quick word with Dr. Saoirse Hume, who is the Public Affairs Manager with Cancer Research UK. Good morning to you.
Good morning.
And this paints a difficult picture across the UK, although, as we've just been hearing there from Dr. Cameron, things potentially slightly worse in Scotland in terms of waiting times, etc. What do you take from this data?
Indeed. I mean, I think this data has probably not come as a huge surprise to a lot of people who kind of work in the cancer sphere, because we've known for a long time that cancer outcomes are poorer in Scotland than some other countries. But I think that was why it was so important that we look at this data. And as Professor Cameron said, it's really looking at the what's happening, that the less treatment and the longer waiting times. And the next step is really why.
The Scottish Government say that they are treating almost 50% more patients on the 62-day cancer pathway than 10 years ago, and that treating cancer is a national priority. How do you respond to that?
I think, we were encouraged by the publication of the new cancer strategy by the Scottish Government, which was just in the summer of last year. And that's a 10-year strategy, so it's really looking kind of long-term, which is what you need to do in terms of planning in the health system. So there was we were really encouraged by the ambitions in the strategy, but really it's given that cancer cases are rising and treatments becoming more complex, we would want to see kind of things moving at more pace, because we've seen in other countries that generally, if there's a robust cancer strategy backed by sufficient funding, that there are larger improvements in survival.
I mean, obviously, from what Dr. Cameron said, the data is slightly old, but more detail is needed to be extracted from it. But what would you like government to take from all of this? Should they be looking at best practice or better practice in other countries and trying to emulate that?
I think so. And there's, the International Cancer Benchmarking Partnership is quite unique in this way, that we're looking, we're very lucky to get this data from other countries. And as Professor Cameron said, it takes time to get the kind of richness of that data. But having those open doors and those conversations happening means, the next step is we can look at why and what we can learn from other areas, because, maybe that we don't need to reinvent the wheel and think of something novel, that these challenges have been considered elsewhere, and we can learn from other countries.
Well, look, thank you very much for speaking to us on the programme this morning. Dr. Saoirse Hume there, who is the Public Affairs Manager with Cancer Research UK.